Okay, so what I want to talk about today is I tend to be a pretty conceptual guy, and I get a lot of questions around where are those different places where health and healthcare and wellness take place. So one easy way to break it down is we can go real simple here and just kind of think about the Venn diagram model, if you will. So if you look at the last 100 years in the United States, specifically, we've seen the bulk of our focus be in the healthcare space. Okay, if you're sick, you go to the doctor. If you're really sick, you go to the hospital. True healthcare in its form. Okay, and then you have two other kind of pockets of area though where you're seeing a lot of growth, especially in the United States. Personal health is one of those, in that you're seeing a huge surge here in the last several years around, health and wellness programs. Geared to that individual, employer-sponsored plans that are trying to get people to be healthier. You're seeing more people wear pedometers, and technology has certainly helped drive this motion, right? So we can now put an application on our smartphone where we can scan the barcode on the candy bar, and it tells us how many calories it is and how that factors into our daily caloric consumption and what impact that has on our overall our health and well-being. Last is another area that we're seeing a huge upswing in, and that's population health, where we start to look at the greater sum and say, okay, what does our population, what does our community look like? And in the winter months, it's really easy to start to think about this in terms of flu outbreak. Okay, so how poorly is the community, prepared? Have they been vaccinated, and how hard does the community get hit? Other things when you think about population health and wellness are, you can look at the saturation of, is there a gym? Okay, can I go and work out? Is there education programs around healthy eating and exercise programs and all of those things? So if you put it in the Venn diagram model, you can see that these do all connect and intersect in a lot of ways. If I take good care of the population through community outreach, through wellness programs, through exercise programs, at the individual level, if I take good care of myself, hopefully I will need less health care, I'll need less reactive health care, and more on the preventative side. So essentially you can see the pieces of this Venn diagram start to shift.